لبيك اللهم لبيك لبيك لا شريك لك لبيك إن الحمد والنعمة لك والملك لا شريك لك لبيك اللهم لبيك لبيك لا شريك لك لبيك إن الحمد والنعمة لك والملك لا شريك لك لبيك اللهم لبيك لبيك لا شريك لك لبيك إن الحمد والنعمة.
Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. This is As You Answer the Call. I am Rashida Abubakar, your regular anchor, welcoming you to another edition of the program. The provision of medical services to Nigerian pilgrims during Hajj exercises is a key mandate of the National Hajj Commission of Nigeria, NAHCON. And so, in continuation of our review series of the 2024 Hajj exercise, we shall focus on how the Commission discharged this mandate through the National Medical Team. All in our Spotlight segment. Also in the program is Making the Hajj and other regular segments such as NAHCON News Diary, which highlight the activities of NAHCON and other stakeholders in the Hajj industry. Still coming your way is the announcement of the quiz winner. These are more shortly. Let's go away.
لبيك اللهم لبيك لبيك لا شريك لك لبيك.
Welcome back and thank you for staying with us. The program kicks off with the News Diary. Stay tuned.
In a related development, the National Hajj Commission of Nigeria, NAHCON, has been applauded for the services provided during the 2024 Hajj exercise. A statement to this effect by the chairman of Hajj and Umrah Tour Operators Union of Nigeria, Suleiman Bemiku, said the union acknowledged the progress made at NAHCON, particularly with regards to early issuance of visa and flight arrangements, as well as the successful management of IBAN accounts by NAHCON. While calling on the Commission to initiate early preparations for 2025 Hajj operations, the union says it is ready to collaborate with NAHCON to improve on Hajj service delivery to Nigerian pilgrims. Meanwhile, the Adamawa State Pilgrims Welfare Commission has submitted its 2024 Hajj reports to the state governor, Ahmadu Fintiri. The state deputy Amirul Hajj, Professor Abdullahi Liman Tukur, presented the report at Government House in Yola. While receiving the report, Governor Ahmadu Fintiri commended the Adamawa State Pilgrims Commission for a job well done, reassuring the team of continued government support for better Hajj exercise in coming years. On his part, the Deputy Amirul Hajj said the report provides the government with detailed perspective on the 2024 Hajj operation, including recommendations on how to strengthen the Hajj management in the state.
لبيك اللهم لبيك لبيك لا شريك لك لبيك.
Alhamdulillah, you are still watching As You Answer the Call, a public enlightenment presentation that keeps you abreast of the activities of the National Hajj Commission of Nigeria, NAHCON, and other Hajj-related matters. While setting up the National Medical Team for the just concluded 2024 Hajj exercise, NAHCON outlined several measures to ensure the health and well-being of Nigerian pilgrims. In our Spotlight segment, we shall take you through how NAHCON implemented the healthcare services for Nigerian pilgrims during the Hajj. Keep watching.
لبيك لبيك اللهم لبيك 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 اللهم لبيك لبيك لبيك.
The National Medical Team is responsible for the medical needs of Nigerian pilgrims in Saudi Arabia, mainly at the primary healthcare level. In line with its mandate, NAHCON constitutes the National Medical Team during every Hajj exercise. Sequel to the formation of the team, the National Hajj Commission of Nigeria, NAHCON, opened a portal and called for applications from persons interested in being part of the 2024 National Medical Team. While this was ongoing, NAHCON unveiled a 15-man committee to review the task of the National Medical Team. Few days after concluding its assignment, head of the committee and senior technical advisor to the coordinating Minister of Health and Social Welfare, Dr. Saidu Ahmed, presented the report to NAHCON chairman.
So the need to have adequate training for medical personnel on the electronic medical record is key to ensure that we also reduce the waiting time for the patient.
With the successful applicants shortlisted, NAHCON inaugurated the 2024 Hajj National Medical Team. This was on Saturday, the 4th of May, 2024, at the conference hall of the Hajj House.
To advise that the kind of patients you are attending to when you are in your various clinics and hospitals are not the same of patients you attend to in Saudi Arabia. Those people that have embarked on this kind of journey will bear me witness. So they are different people entirely. So you have to be patient.
Soon after the inauguration, the shortlisted candidates were subjected to further screening to ensure compliance with all requirements needed to serve pilgrims. And in order to strengthen the medical team, Federal Ministry of Health supported NAHCON with drugs. The Director General of the National Primary Healthcare Development Agency, Dr. Mui Aino, handed over the drug consignments to NAHCON in Abuja. The consignments consist of a wide range of medications such as anti-malaria drugs, antibiotics, pain relievers, antidiarrheal medications, and vitamins and supplements.
We have also provided essential medicines that cover quite a wide range of common ailments that people have. We have analgesics, pain medicines, both what you take orally but also what you inject. We have antibiotics for the types of infections that people can get when you are in crowded places, when you are stressed. We have IV infusion to resuscitate people who need it, among many other medications and supplies that you need.
Working through its strategies during the period under review, the National Medical Team deployed personnel in Mecca and Medina to man the clinics established in these places.
In Medina here, we also have team leaders for doctors, for pharmacists and nurses, as well as team leaders for environmental health. At the same time, because of our long-term collaboration with the Ministry of Health here in Medina, they make sure that they give us license to operate as many clinics as we think are necessary to look after the health needs of Nigerian pilgrims.
In Makkah, we have two main clinics, one at Masfala Kudai, which is Darul Musafirin, and then the one at Shahru Mansur, that's Darul Fahad. These are the two major clinics. The others we had outposts. We wanted more than 4 actually, but unfortunately the Saudi Health Authority were not fast on that. So we ultimately ended up with about 3. We had one in Borno, we had initial one in Nasarawa, and then one in Kano.
All the clinics and outposts established worked within the guidelines provided for primary healthcare services as approved by the Saudi Ministry of Health.
And knowing fully well we are dealing with a huge crowd that is mixed, not necessarily well disciplined around hygiene and sanitation. And because of the exigency of the situation, even those that are really keen on doing that, they may not find the opportunity. So cholera and other typhoid, septicemia, acute diarrheal diseases were actually on the forefront for us. And then acute conditions that have to do with chronic diseases, such as hypertension, diabetes, asthma, and other related diseases that are very common among the pilgrims.
So most of the pilgrims we see are those coming for refill of their medications. They are either hypertensive or diabetic. They left their medications at home, which is not too surprising. So immediately they report for getting the refills. But however, nonetheless, we still have had cause to see some real medical emergencies, averagely about 1 or 2 per day. Some we handle here in our facility, and then we've had cause to refer about 8 pilgrims so far to Saudi hospitals.
And one confidence building strategy we deployed was that anytime we take our patients to Saudi, we just don't take them and dump them. When we take them, even if they are 5, the nurse or the doctor will stay, he will give his number, and then he will tell them, I'll wait for them. So if they make their assessment and see that, oh, they don't need him to stay, it may take long, they will tell him, no, I have your number. We will call you as soon as we are done. And so the instruction we give them is that make sure as soon as they call, you bridge the gap. Within minutes, you are there. And then you pick the patient, you bring them home.
To ensure accessibility throughout the Hajj period, the medical facilities were strategically situated around pilgrims' apartments.
The proximity of the clinics are really around the general, usually like 3 minutes, 5 minutes walk. For example, the one in Masfala Kudai, you have Bauchi, you have Kano up, you have Sokoto up, you have Kebi, you have Kaduna, you have Lagos. All of them you can just walk in 5-7 minutes, towards them. So it's easy, and we situated the clinics deliberately after knowing that the states have captured their accommodation. So usually the clinic selection come after the states have taken up their accommodation. We now follow it and say, okay, this cluster, we have so states, we'll site it there.
And we make sure that we disseminate information through these media handles. In addition, we have also sent the addresses to all the hotels where Nigerian pilgrims reside. And then by way of also information, we try to educate other pilgrims to also be our advocates, informing other pilgrims about our locations. In addition to all this, we also have a medical surveillance team that moves from hotel to hotel to identify pilgrims with medical issues and then move them to our nearest clinics.
Prior to the Mashari outing, that is, Mina, Arafah and Muzdalifah, the clinics attended to nearly 12,000 patients. Out of this figure, 12 deaths were recorded, 13 psychiatric cases, 20 fractures, and 4 pregnancies also recorded.
Out of that, Makkah has taken 7,700. Medina, they saw 3,800.
While explaining the nature of their health challenges, Nigerian pilgrims who were attended to at the various clinics bear their minds on the services rendered to them.
I have already got a medicine that I'm suffering from catarrh and the blood pressure, in which you are seeing the medicine I'm given. 3 of them all are medicine of the cure of my illness.
Wallahi da kwalsa ne da ciwon kai da zazzabi haka da gwiwoyi da ciwon kunni ya kawo ni wannan asibiti. Gaskiya na ga abin da a tsara ya mun sha'awa, ya mun fiye da baka zato, an kula da mu fiye da baka zato. Mun gode Allah gaskiya, ba mu ga wani muskila da abamu da malaman asibitin har magoya bayan su ba su ba mu matsalan komai ba, sana ji da mu.
Ina da ulfa jikina kuma gwiwa yake damuna, yawa kuma shine na zo wurin likita ya bani magani. An bani magunguna da kwayoyi biyu an ba, zan je sha kuma Allah kuma ya kama da sauki. Allah ya taimake mu. Alhamdulillah, na gode Allah. Ana kula da mahajjata yanda ya kamata. Yawa kuma Allah ya kama da lafiya.
To yanayin canji ne, rana ne yayi yawa, ciwon kai ne ya dame ni, kuma yan uwana suka taimaka min sun da amirul haji da ma'aikata duka suka kawo mu asibiti. An kawo mu kuma an taimaka mana matuka, sun yi kokari ba aje mu ba, daga zuwan mu kawai ana duba mu. Ina godewa ma'aikatan wannan Madina.
At Mashair, where the core Hajj rites were observed, NAHCON deployed 4 ambulances to attend to any emergency. The ambulances came in handy. A number of medical cases were treated using the facilities in the ambulances. One of such cases was the heat stroke that rendered 17 Nigerian pilgrims unconscious.
And all of them were saved, the 17. They come into our ambulances unconscious and they go out walking and talking and gisting, meaning that was actually heat stroke. All they needed was AC and IV fluid, and they were saved, alhamdulillah.
Some of the major challenges faced by the national medical team during the period under review include the malfunction experienced with the electronic medical record system. Others include late approval to set up medical clinics in Makkatul Mukarramah. With preparations for the 2025 Hajj underway, NAHCON has reiterated its commitment to consolidate on the gains achieved, as well as address challenges faced, and introduce new measures for better healthcare delivery.
لبيك اللهم لبيك لبيك لا شريك لك لبيك.
MashaAllah, the program is As You Answer the Call. Coming up next is Making the Hajj. Don't go away.
لبيك لبيك اللهم لبيك 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 اللهم لبيك.
Performing the Hajj or Umrah have spiritual messages pilgrims are expected to imbibe because of the benefits to the pilgrims and humanity in general. What are these lessons? How will pilgrims benefit from them?
Then we should try to avoid all those things that Allah has.
On Making the Hajj tonight, Malam Adamu Abdullahi answers these and other questions.
Well, Hajj brings about unity among the Muslim Ummah in many ways. One of which, bringing them together to perform certain acts of worship simultaneously. So, if you observe Hajj, you will find Muslims from different countries with different languages, with different tribes, but they perform acts of worship together, like the Tawaf, like the Sa'i between Safa and Marwa, and most importantly the standing on Arafat, which is the climax of Hajj, which all Muslims of the world perform on the same day.
The convergence of pilgrims in one place at a time symbolizes the Day of Judgment. This is also a lesson for pilgrims. During Hajj, pilgrims share the same feelings, clothing, rites, and times. This gives them the feeling of being brothers and sisters in the fields of life and religion. The expectations of pilgrims after the Hajj is Allah's rewards and forgiveness. Hajj reminds pilgrims to stay clear of any act that is not allowed in Islam.
Ihram, there are certain rules that he has to observe. Immediately he takes that intention and wears those clothes, pieces of white dresses by men. Of course, women can wear any dress as far as the dresses conform to the Islamic principle of hijab. But he is prohibited from certain things, like rubbing scent, cutting his nails, cutting his hair, or hunting, or killing any animal except harmful ones.
Hajj teaches pilgrims humility.
So one has to be patient to spend his money. One has to be patient to do certain things that ordinarily, for example, when you are going to Jamarat to throw the stones on the 10th, 11th, 12th, or 13th, from tent C, where most of the pilgrims stay, to Jamarat is about 5 kilometers. Ordinarily, at home, it is not easy for somebody to trek for 5 kilometers to go and come back. And even the Safa and Marwa that one goes up and down, if you calculate, it's many kilometers. So one has to be patient to exercise this acts of worship.
Imam Adamu Abdullahi advises Muslims to always seek knowledge about Hajj and Umrah so as to perform it in line with the teachings of Islam.
Alhamdulillah. Now it's time to know the winner of last week's quiz and the question for this week. Good luck.
لبيك لبيك اللهم لبيك.
Welcome to the quiz segment. The question in the last episode was, name the 3 persons associated with the history of Zamzam water. The correct answer is Prophet Ibrahim alayhi salam, his wife Hajara, and their son Prophet Ismail alayhi salam. The winner is Olajuwon Idris from Lagos State. He provided the answer ahead of others. Olajuwon Idris will be contacted on how NAHCON will reach him with the prize he won. A quiz winner will get 25,000 Naira cash prize. This is part of NAHCON's efforts in social investment in Nigeria. Now to the quiz for this week, and the question is, what pillar of Hajj is associated with Hajara and her son Prophet Ismail alayhi salam? Again, what pillar of Hajj is associated with Hajara and her son Prophet Ismail alayhi salam? Text your answer to the number showing on your screen. The winner will be the first person whose correct answer is received. All answers should carry the name and the location of sender. Good luck and happy viewing.
Once again, good luck to you. Up next are your messages.
لبيك لبيك اللهم لبيك لبيك لبيك.
The first message came from Abdul Qadir Rabi Udederi. It reads, I must commend the efforts of NAHCON in this year's Hajj operation, particularly the feeding and accommodation provided to pilgrims. I hope NAHCON will sustain the tempo in subsequent Hajj operations. The message was taken from our Facebook page. Also from our Facebook page, Bashir Lawal made this comment. We thank Allah for the success of 2024 Hajj. May Allah spare our lives to witness more and contribute to the success of Hajj in coming years.
This is where we draw the curtain on today's program. See you same time, same day next week with another edition of the program. But before we go, remember that you can send your messages, comments, observations and questions through our mobile phone number and other social media platforms. Once again, thanks for watching. Ma'assalam.
لبيك اللهم لبيك لبيك لا شريك لك لبيك إن الحمد والنعمة لك والملك لا شريك لك لبيك اللهم لبيك لبيك لا